Oregon has a mental health crisis, and a big one. I don't think there's anyone out there that would disagree. Many of us have stories of someone in our family or our community who've struggled, and you've likely seen someone on the street in crisis. Research shows just how bad it is, by the way. A national health report showed nearly 35% of Oregonians reported symptoms of mental health disorders last fall. That's 3% above the national average. Mental Health America ranked Oregon dead last for access to care based on the prevalence of mental illness. Now, we know that mental health disorders can affect anyone at any time, and they're a big driver in leading people to homelessness and keeping them there. We get a lot of emails and voicemails about this, including this one from Michelle, who said, "I have not heard one person mention mental health or addiction treatment. Whether we build housing for the homeless or put them in large shelters, the problem itself is never going to improve if we don't first invest in mental health and addiction services." Well, good news. In the past legislative session, that actually did happen. Lawmakers passed the biggest investment into mental health care in Oregon state history, $1.25 billion. That's a ton of money. It'll go towards things like creating more residential facilities, expanding community behavioral health facilities, which help people regardless of their insurance coverage, and millions of dollars will be focused on hiring more health care workers in the mental health space. This week on Straight Talk, Laurel Porter interviewed two of the Oregon lawmakers who helped pass that funding.
It's historic. And we're going to use that word probably too much, but it is really important for viewers to understand that we have made an investment that has never been made at this level into the system. Not only into our mental health system, but we've made historic investments in substance use disorder treatment as well as housing. And when I look at this problem, I call it my three-legged stool. You have to invest in substance use treatment, mental health treatment, and housing. And if you don't invest in all three of those, you have a wobbly stool or a stool that falls over.
Mental health treatment is a complex problem. We didn't get here overnight, and we're not going to fix it overnight. But lawmakers say they do expect changes to be implemented starting this summer, and they're asking mental health organizations to bring them their ideas.